the candidates and reporting in a way only we here at KTN can. Let's move away from politics now. At least 15 people, among them 2 doctors who are staying at Nairobi's Weston Hotel, are suspected to have cholera and are undergoing treatment at various hospitals within Nairobi. They were among 400 participants at a scientific conference at the Weston Hotel here in Nairobi. The conference was today on its 4th day when the reports of this illness came to light. Numbers of those affected may rise, as our Dr. Mercy Korir now reports.
A number of medical professionals had converged at the Weston Hotel for a scientific conference to discuss lung health, but instead, some of the medics are nursing food poisoning suspected to be cholera.
The patients were presenting with nausea, vomiting, fatigue, and diarrhea.
Measures were quickly put in place to treat those affected on site.
We also had to mobilize resources to make sure that those who are sick are taken care of, either referral or treatment.
Confirmation of the bug that has scuttled the medical conference is being worked on.
We took samples, both food items and water from the hotel, to National Public Health Lab to find out what it could be. We have also taken stool samples to the same institution. The results are not yet out. But presentation of these cases is not typical of cholera.
Cholera is a bacterial disease that causes watery diarrhea after eating contaminated food or water. It takes between 12 hours and 5 days for symptoms to show. If untreated, the diarrhea causes dehydration that can lead to death. Suspected cases of cholera are confirmed by identifying the bacteria in the stool samples of affected patients. This takes at least 48 hours. Usually, cholera is associated with lack of clean water and poor sanitation. Therefore, prevention and control of cholera involves hygiene and proper sanitation, treatment and use of cholera vaccines.
Eating food, the source you are not sure of, and water which you are not sure of, we should take water, particularly drinking water from a source you know. And also when you visit the small room, you should wash your hands.
The search for the source of the infection has been intensified from both patients and the Weston Hotel.
We are looking at those cases. We are treating retrospectively, going backwards to see where they come from, to try to identify index cases. Food handlers in the hotel, we are trying to analyze them, lab analysis of stool, blood, to ascertain whether any of them could be source of this infection.
That is a laboratory exercise that will take the next 48 hours. The Ministry of Health and the county government of Nairobi are yet to confirm the source and